I'm
China,
sorry,
Beijing.
I'm sorry, my voice is not good, so I ask my colleague Jiang Long for the presentation.
Absolutely, absolutely.
Yes, so I have the honor to report our updates from East Asia region. So I'm going to report one country by one country. So the first country is China. So in 2023, we had CADEPT annual meeting. So it was 13 years anniversary for CADEPT, which stands for China Association for Drug Abuse Prevention and Treatment. Next slide, please. And also next year, what CADEPT did is that we had a visit to the US. So the delegation was led by Professor Wei Hao. Professor Wei Hao was invited by the US Department of Health and Human Services for the visit to the United States in November. I mean, the end of November to the beginning of December next year. The delegation visited the National Institute on Drug Abuse of the US and also National Institute on Alcohol Abuse and Alcoholism, Mental Health and Drug Abuse Services Administration, and the US CDC and FDA. And they also had very constructive discussions with American academic organizations such as the American Society of Addiction Medicine and the American Society of Addiction Psychiatry. And also the delegation visited White House Office of National Drug Control Policy and the Office of Drug Demand Reduction Programs of the US State Department. I think the way that really promotes collaborations between China and the US on drug abuse. Next slide, please. Another thing just happened in the beginning of this month is that in Changsha, Hunan province in China, were Central South University, the second Shanghai Hospital, Central South University, which is a WHO collaborating center on substance use, hosted a WHO meeting on postgraduate education and doctor training on addiction in Changsha. The meeting was a collaboration between ADA team at the headquarters of WHO, led by Vladimir, and the addiction team led by Professor Wei Hao at Central South University. So at meeting, we also I was there as well as a chair of ISOMNEST, and also we invited Professor Mark Potenza to Changsha. So we talk about the postgraduate education and training for medical doctors in prevention and management of disorders due to substance use and addictive behaviors. So the meeting was a really a big success, and I think we had really productive discussions. And also, I think there will be some meeting notes and also meeting reports perhaps will produced by ADA team at the WHO headquarters. Next slide, please. So I also would like to elaborate a little bit on the background of the meeting. So the background is so I think the ADA team, I mean the WHO, believe that the effective implementation and scaling up of prevention and treatment interventions for disorders due to substance use and addictive behaviors in primary healthcare requires availability of specialized services for referrals, and accordingly, proper trained health professionals. So against this background, the meeting is envisaged to concentrate on postgraduate education and training of medical doctors in the field of addiction medicine. Next slide, please. So the specific objectives of the meeting is to discuss the concept, scope, nature, and the procedural aspects of education and training of medical doctors in addiction medicine. The second objective is to discuss core competencies of medical doctors specialized in addiction medicine. Then the third one is to discuss the role of the WHO in development of health specialized workforce and required activities at global level. The last objective of the meeting is to develop a roadmap for WHO action on specialized health workforce development. Next slide, please. Oh, so there is some, order issues. So yeah. Then I will share some information from our colleagues from in Japan. So to respond to the specific question raised by Hamed before this meeting, Japan, the only affiliated society to ISAM in Japan currently is the Japanese Society of Alcohol-Related Problems. No other societies are affiliated with ISAM right now. Next slide, please. And when it comes to South Korea, the Korean Academic of Addiction Psychiatry, KAAP, is the only affiliated society in Korea. Actually, KAAP was we and ISAM had a joint meeting last year during the international conferences of behavioral addictions in Incheon last year, and no other domestic organizations in the process or have a plan to become affiliated to ISAM. Next slide, please. And for Mongolia and North Korea, no domestic organization is affiliated with ISAM or in the process or have planned to be affiliated with ISAM right now. But I think Professor Wei Hao now is working on it and trying to persuade more associations in the region to be affiliated with ISAM. Next slide, please. I think it's the end. Yeah, that's the end of my
Okay.
presentation. Thank you. Yeah.
Thank you very much. Thank you very much.